They say they cited the situation in Australia as a justification for the decision. The swine flu has progressed a little faster here than in the Northern Hemisphere, and the main reason being, of course, that it is winter here, and winter is a time when transmission of any influenza is heightened, and so Australia is probably most at risk. There's no doubt that Australia is at the forefront of the pandemic. There have been over 1,200 cases recorded here, and some predict that up to 30% of the population could be infected before a vaccine becomes available. But so far, the symptoms of the flu have remained mild, which explains why many Australians don't feel particularly threatened by the disease. Having said that, there are 5 people in intensive care, so health authorities are keeping a close eye on the situation there.
Australians not panicking then, but I gather there are emergency talks due. What can we expect to come out of those?
Look, they are meeting today to discuss Australia's response to the World Health Organization announcement. We met yesterday with the New South Wales Chief Health Officer, and she said that the decision to declare a pandemic may not necessarily trigger a change in response here. There are already solid measures in place, which include screening at airports and quarantine measures. Schools have also been asked to shut down whenever the disease was detected among the children. What might come out of this meeting is a standardization of the approach. At this stage, each state in Australia is a separate jurisdiction and has its own level of alert or response. What the health authorities might decide to do today is to uniform the response across the country.